Good morning. So thank you, Mike, for the nice introduction and for introducing me to the Gordon community over the past few years. It's been a pleasure to work with you and the students here. And thanks for inviting me to give a talk on such a beautiful fall day. This is great timing to leave Cambridge and come out and see the beauty of northern Massachusetts. I'm going to talk today about humanitarian supply chains, but I'm going to position this a little bit with my own personal and professional journey. And I'll tell some stories. I sensed at an early age that I did not want to be a missionary, but I wanted to demonstrate my beliefs overseas somehow and help make people's lives better. In part, I did not want to go and pass the hat to raise funds. Not that that's not appropriate, it's just that I was really bad at that. When I had to do the fundraisers as a kid for baseball, I was really bad at going and selling the cookies and things at the door. And I wanted to find a way to effectively pay my own way to exercise my beliefs and my convictions in helping people around the world. This may have been due in part to my father's influence, who started his own construction company and felt that you should try to do as much as you can with your own skills and contribute value to your community. But the path to where I could reach the point where I'm able to do this and exercise my convictions and yet do it in a way that people value my contributions has been a bit circuitous. As Mike said, I started studying math. First of all, it was pure math, and then I did a master's degree at Colorado State in applied math, where I realized applied math means you have to have an application. Then I realized that more of the applications came in engineering, and I studied engineering at Georgia Tech. And at Georgia Tech, I found that you could mix math with maps. I always liked maps in studying something called logistics or supply chains. So supply chains are the connections of various manufacturing facilities and warehouses and retail points that help deliver goods to the stores and nowadays to your home through Amazon delivery. So I've become an expert in using math models and decision models to help make those supply chains work better. When I came to MIT, I'd been working with the private sector for a long time, working with companies. I did my dissertation with Ford, helping them improve their spare parts supply chain. I'd worked overseas in Amsterdam with a lot of other companies. When I came to MIT, I had a student who said they wanted to study humanitarian logistics. This was right before the Indian Ocean tsunami in 2004, which was kind of a seminal event in the humanitarian space where they realized that logistics was an important aspect of being able to meet people's needs. And it was that student who kind of began my interest and my connections with that sector. Although my connections went, again, from my roots from the beginning. These are some pictures from growing up. I would respond to disasters. I'm from Kansas, and so we would go to tornado disasters. And I would go with, I'm from a Mennonite background, so there's a group called Mennonite Disaster Service that would show up, and this was the first one they responded to in 1954, a Udall tornado. But since then, they built a tradition of being able to be one of the first responders. In fact, the Red Cross and the Mennonite Disaster Service are the only two organizations that are allowed in by the police after a tornado in Kansas. However, the work is long. You have to stay for a while to do reconstruction, and it's not very fun. This typically what you're doing is you're mucking out flooded basements. So that began my interest in this, but it was a long time from my youth of going and working with tornado response to what I do today. My most recent experience has been very different. It's with the Ebola response in Liberia. So for those of you who may have been paying attention to the news, you may have seen pictures like this last year of people in West Africa dressing up in these yellow suits with all of this protective equipment so that they could then provide treatment for patients with Ebola. Because the healthcare workers are among the most vulnerable in an Ebola outbreak. And so that protection is essential to provide treatment for a patient, but yet make sure the healthcare workers are alive. And as a result of that, this equipment is very bulky, and you need to change it often. So this is where the supply chain and logistics comes in. To provide treatment for those people, we need to bring in lots of supplies of this protective equipment. And in fact, last August, UNICEF set a record for the most supplies they ever provided in any month, in great part because there were several emergencies around the world, but in great part because of the ramp up of these kinds of supplies in West Africa. And that response to provide treatment centers and scale that up was fairly effective. However, at the same time, there were gaps. The focus of providing treatment centers was important, but yet at the same time, the health facilities in the country were not getting the resources that were required, and the healthcare workers in those facilities were vulnerable. As a result, in the capital city of Monrovia, it's a city of 1.5 million people, for the entire month of September, there was no hospital open because the workers didn't have the protective gear to provide services. And it's not wise for them to provide health services in an environment where they do not have that security that they would not contract Ebola. In fact, early on, you can see these are the numbers overall. The population of Liberia, 0.11% died of Ebola, but over 8% of the healthcare workers perished from Ebola. And this is a country with not a lot of healthcare workers to begin with. So there was a clear gap, and that gap was made aware to me by colleagues that I've been working with and teaching with at Harvard over the last few years, colleagues at Boston Children's Hospital. And so we put together a consortium of various academic institutions to help address this need. It was UMass Medical School, Boston Children's Hospital, Mount Sinai in New York, my lab at MIT, and then some colleagues of mine who've been in Venir Analytics who work with UN and Red Cross organizations in providing logistics consulting. And we set up teams of healthcare workers in Liberia to do training and provide supplies for those hospitals. Our program was to provide infection protection and control training and equipment. And the important thing here is there was a lot of focus on providing training, which is not easy to do, but doesn't take a lot of resources. But the important thing is that you provide training with the equipment. A lot of the training was being done, in some ways in theory, because the equipment was not in the hospitals. So we made sure that if we were going to provide training, we were also going to provide the equipment that they could use so that they could open the facility safely and feel confident in providing healthcare services. In addition, it didn't have to only provide the protective equipment, but the sanitation equipment and the equipment to protect the sanitary workers to clean facilities on a regular basis is very important. And setting up quality improvement and then leaving behind focal points to maintain that training and those standards over time. So the challenge that I was addressing, my colleagues were focused on the training part, working with CDC and WHO to make sure that the training was taking into account the latest knowledge about how to prevent contraction of Ebola. I was responsible to make sure those supplies got to Liberia. The first challenge was, and this is kind of going to introduce you to the supply chain through the different stages of this response. So the first step in a supply chain is to procure the supplies. This was a challenge last fall because, as you saw, UNICEF was setting record months. There were a lot of organizations ordering the exact same equipment. There were not many suppliers of that equipment. In fact, there was a big meeting in November, early November, that UNICEF convened with various stakeholders and the private sector to say, can you even manufacture what we may need if Ebola continues to spread? At the same time, they were tapping the traditional healthcare providers. We worked with an industrial distributor who had worked with a company to procure protective equipment during oil spills in the past. And it turns out that the same specs for the equipment at that manufacturer met the specs that the international community set for prevention of fluids for Ebola. So we found an alternate supplier by tapping into a different channel, and were able to procure the suits. In addition, later on, when we added a few hospitals to our program in February, by then the Ebola outbreak had subsided in great part, and there was a lot of supplies there were stocks of this equipment overseas, but yet they didn't know if it was appropriate or fit for use. But we found some stock that the Ministry of Health, that was donated to the Ministry of Health by an organization, by an international aid organization, checked the specs and made sure that it met the specs of WHO and CDC, and was able to repurpose that donation for use in the hospitals. So it's a combination of finding alternate channels that others weren't identifying with this first suit, the EnviroGuard suit. And the second one was leveraging stocks that had been donated and making sure they're fit for purpose, but not going ahead and bringing new supplies in when they were already in country. So procurement was a big step in that response. In addition, we had health care teams that needed to go out and provide the services. We needed vehicles for them to go out to the facilities. In this case, we had to procure vehicles, but we were fortunate to get a donation. And this happens a lot in a disaster response where there's in-kind donations. Somebody will provide something to you, and you have to determine if it's fit for purpose. In this case, it was the UN and the UN mission, Global Ebola Response Mission, that had a fleet of 4x4 vehicles that had been in Darfur for a few years and were no longer being used by a program in Darfur. And so they made them available to us. You can see up in the right corner here, that's the dashboard. It's all blistered because it was really hot in Darfur. So we could definitely tell that they had come from a different part of West Africa. But we had to make sure that those vehicles were going to be appropriate for what we were going to be doing, because they had been used for a few years. It was pretty hard terrain in Darfur. So we had to refurbish them. We had to make sure they were overhauled by a proper mechanic. We had to put new tires on them. We wanted to make sure we labeled them with our organization name so it was clear that we had authorization to be working in that country and to be moving around. We had to add appropriate safety equipment, and we had to train the drivers to be able to provide safe transport. The ability to move around in a crisis is essential, and the ability to have properly trained drivers and properly equipped vehicles is foundational to this. And I was fortunate to have my colleague from Venir Analytics who was an expert in doing that. So we now have our supplies, we have our vehicles for the teams. We need to get the supplies from the US to West Africa, and that's where, for me, the most fun part of the journey came in. We procured enough supplies that we could charter a cargo airplane. And it turns out, I didn't know this before, and because I usually teach about logistics, this is a rare occasion where I actually got to do it, but I learned that when you charter an aircraft, they give you one of the jump seats to fly on the airplane. So I got to fly with the cargo from the US, it departed from Miami, to Liberia. So this is our protective equipment that we're flying over for the hospitals in Liberia. This is the jump seat, and this is our luggage. You don't have an overhead compartment on a cargo plane. And this is our catering here, this little cooler. You don't have any flight attendants with drinks. They just put a cooler of a few items for you to eat on the plane. So it isn't luxurious on a cargo plane. But it was really exciting when we landed in Liberia, and I could see through the cockpit door here the cargo on the ground already, on the tarmac in Liberia, waiting to go. So we offloaded the plane, and then we met the next step in the journey, and that is making sure you can properly bring the items in the country. This is a bit of a mess. Sometimes this is a challenge in a disaster response. In fact, Professor Veach and I have studied this in the Haiti response in 2010, that the airport can become a bottleneck, and it's very difficult to pull things out of the airport. And so things pile up, the goods pile up, and you have to identify your cargo. So that's me standing on top of a bunch of pallets trying to make sure I identify all of the things that we brought in, because it's just offloaded and put onto the tarmac. You also have to make sure that you're following all the proper documentation. And in this case, the government of Liberia provided an expert who knew how to get the right signatures quickly and get through the paperwork effectively. So the government provided a very useful service in making sure that these important goods could be brought in quickly into the country. And finally, I used to think that when people would put big logos on the side of pallets in a disaster response, they were trying to do advertising. I have learned that it's very important to put your logo on your pallets because you have to find them on the tarmac when you get there. So labeling, that label was a very essential thing to make sure that we could identify our cargo and get it moving quickly. Once it left the airport, we would take it to a warehouse. In this case, we leveraged the services of something called the logistics cluster. The logistics cluster is run by the UN organization, the World Food Program, to provide services on behalf for all the different organizations to tap into their capacity. So they will set up warehouses and set up transportation and make those they get funding directly to set up those the warehousing and transportation facilities and then offer them up to the community. So we were able to take advantage of that in Liberia. So some of the storage they had repurposed a sports arena for some of the goods here, and you can see the outside of it there. but a lot of the goods were stored in temporary facilities like this tent here. These temporary tents are very common in disaster response where there's not a lot of warehousing capacity. So this was our tent. We quickly filled it up with goods and made sure we had stock. We had accounted for all of the stock, and we then set up a warehousing operation with a local, we hired a warehouse manager to make sure that they tracked everything that came in and out of our warehouse. To transport things in country, we also leveraged the transportation services provided by the logistics cluster. So this is the truck that took the goods from the airport to our warehouse. It's a flatbed truck. I say flat in a rough sense. It's a bit old, and the boards were kind of up and down, and it was a bit tricky to load, but it was a large truck that could provide a lot of transportation. And it was a local provider. It was a truck that had been providing transportation in the country before, and they contracted them. In addition, the UN brought some trucks in for delivery. These are a bit smaller trucks, and that's the front of it. This is the back of it making a delivery here. And I'll say that there was a little bit of a pushback from the local Liberians from the UN bringing new trucks in and displacing the transportation services of the local economy. But sometimes you need to bring in appropriate vehicles to provide reliable transport, and that's always a balance. How can you leverage the private sector effectively, but when do you need to fill a gap with other assets? And this is our first delivery at the major hospital in Monrovia. It's the major public health hospital in Monrovia, the largest one, Redemption Hospital. And I was very proud of our team in Liberia that from the moment it landed on the tarmac at the airport on Monday afternoon, that this first delivery happened first thing Friday morning. That's very fast to bring things through custom, to take stock, to make loads, and to transport it. So they were very effective in getting that, in that emergency moment, in moving things quickly. I'm also showing you a picture of what the local team sometimes had to encounter and why we focused on appropriate 4x4 vehicles with proper maintenance and proper tires, because our teams need to be secure when they're traveling roads that look like this. What does this lead to? In the end is we are helping to facilitate, through funding from the Paul Allen Foundation, skill building and capacity for the future as well. So these are the training teams that provided the training on how to protect yourself from a viral disease like Ebola. And so it's relevant, obviously, for Ebola because it's still endemic in West Africa, but for other diseases as well, that proper training on infection protection and control. We also train drivers on how to safely and securely provide transport to workers in the country and how to provide proper logs and make sure that we're tracking our activities effectively so that security will not become an issue. We train people at the local hospitals on how to do proper triage and how to make sure that you wash your hands appropriately, for example, with the chlorine solution at the beginning. The workers learned how to don and doff the protective equipment effectively through training with the teams they provided. And finally, last but not least, the workers who stock the shelves, which is, again, the supply chain component that I work with, to make sure that they know how to place an order when they're low on stock, and where do they go to find more resupplies. And that's what we're going to continue doing. We got another grant now from CDC to continue providing work in that country to set up the system so that this happens more formally through the public health Ministry of Health in Liberia, to provide training and a base set of stock for emergency response and for outbreak response going forward. One of the side things in this whole intervention was we designed everything. We also encountered some unanticipated aspects. So in making chlorine solution, you have to have clean water. And occasionally we would come to a hospital that had a well that looked like this. So fortunately, with some of the cost savings that you saw highlighted throughout, we were able to leverage different services and save money on our supply chain. We were able to provide additional things that were not initially programmed, and that is refurbishing some of the wells, for example, to make sure that water can be drawn effectively and safely. In the end, when you have a program like this and you have a donor, you have to report back to them. So I have one slide with some math on it. And it is important to track your impact as much as possible. And I will tell you, if any of you have taken or you have to take any statistics class, please pay attention because this could be useful in the future. Whether you're going to be a math major or use it on an ongoing basis, statistics can be very helpful in demonstrating the impact you've had and then help you raise funding for your endeavors in the future. And in this case, we have a very significant change in the minimum standards. It's a questionnaire that's developed by the Ministry of Health, and the minimum standards were definitely improved in these hospitals so they can safely provide health services. So this is an example of a disaster response, but it's really pointing to what I think is the future of responding to disasters, and that is strengthening systems. In this case, we strengthened the system of the Ministry of Health in Liberia. We worked with government hospitals to help them understand the supplies that are required and the proper training and protocols to safely provide health services, even in the midst of an Ebola outbreak. These systems in some countries are mainly provided through the public system, like in Liberia. In other countries, it may be through faith-based organizations. In Zambia, for example, the Churches Health Association of Zambia has an extensive network, and you may not be able to see all, but there's lots of dots here. There's lots of clinics, hospitals, training facilities that are run by this faith-based consortium in Zambia. It's another system in providing health services that complements the public system in Zambia. And finally, the private sector can play an important role in providing health services. This is a study that was done by a couple of my students in Zambia with a major pharmaceutical provider. So the pharmaceutical provider is looking at Africa in two ways. One is they want to provide better health outcomes through providing access to their medicines. So they're lowering their prices to make it accessible. But yet they're a company and they do see that there's an opportunity to make profits there. They're just going to make profits instead of selling it with big margins and small volumes. They want to sell small margins and have big volumes. The key is, how do they find ways to tap into the different private sector outlets in that country? And so this is where we visited. This is the representative from the pharmaceutical company. And this is where, on our journey from Livingston to Lusaka, we came across, I happened to spot a little sign, and this is a guy who had just opened up a pharmacy the year before. He's an entrepreneur, he was a pharmacist, and it was a town that didn't have a pharmacy within 2 days' walk of anywhere around. And so this is the only pharmacy available, and he had just set it up. As an entrepreneur, he drives a truck to the capital city once a week to pick up supplies. When he goes to pick up supplies in Lusaka, he has to close his pharmacy because you cannot have a pharmacy open without having the pharmacist there. So he's an entrepreneur that's trying to build a business. Here's a pharmaceutical company that's trying to grow margins. But in the end, if we can make that large pharmaceutical company connect with that entrepreneur, we can provide better health outcomes for that region because that pharmacy now exists. That ability to tap the private sector, I think, is a growing opportunity for not only providing response to disasters, because the private sector has the capacity to scale up, but also ongoing development and health outcomes for the country. This is not only in health. I mentioned we do food security as well in our lab. This is an example of another private sector initiative. So in Darfur, there have been refugees for a long time since the conflict, and there still are displaced people in Darfur who need support in terms of food aid. The World Food Program, represented by this guy here, is providing food, and a lot of the food they bring in from overseas and they distribute. But increasingly, they are trying to do a different mode, where instead of bringing food in, they give the beneficiaries here a piece of paper to go to a local market and buy from these guys who are local traders. By giving a voucher for goods, they then enable the beneficiaries to have choice. Rather than giving them something, they can choose what they would like to purchase in the market. They also strengthen the business and the economic opportunities of these traders by giving them some demand, and they can try to scale up their efforts. So it's a way of trying to catalyze the market and enable the market to provide more of this food aid in an area that traditionally and historically has not had as large of a population as they do now. Another interesting aspect of this, though, is when you use these kinds of private sector market mechanisms to provide aid, you actually provide it more appropriately. So I'll highlight here, this is the voucher, this is the front side of the voucher. And if you can see, I don't know if you can read it here, but it says groundnut oil. How many of you have heard of groundnut oil? Has anyone heard of groundnut oil? So oil, it's an oil that they use for cooking. When the World Food Program brings in supplies that are given by donors, they bring in vegetable oil. It turns out the people in Darfur do not like cooking with vegetable oil. They don't know how to cook with it. They much prefer to cook with groundnut oil because it's grown locally. These groundnuts are grown in Darfur. So not only are we providing, by having a voucher for groundnut oil, we're not only providing access or opportunities for the market traders, but also for the farmers in the region, because that's where the groundnuts are grown. But most importantly, we're providing the goods and the items that the people prefer anyway. So through local markets, you can provide much more appropriate aid. In studying the voucher distribution in Darfur, and Professor Veach actually we had a student that worked on that as well and looked at some of the analysis of that operation, we identified that one of the issues is how the traders can how they can do their own procurement. And especially in a country with limited storage, it's not like in Kansas where I grew up with these great big grain silos. There's not a lot of large-scale storage, and farmers sell almost all of their harvest all of their crop harvest right when they harvest the crops. So there's an increasing effort to try to see what are some mechanisms to enable them to store their crops a little longer, to provide supply throughout the season, and not only for the ongoing needs of a population, but also for their own consumption. So these are metal silos that are being produced in Uganda, and we've done a project this last year with the support of the U.S. Agency for International Development in studying how these silos could provide ability for farmers to store their crops for their own consumption, but also to sell when the markets have higher prices long after the harvest. It also provides supply that could be used if there is a shortage that you can store effectively. So if there's a year when there's a lean harvest, there can still be storage from previous harvests and provide for that. So you wouldn't need to bring as much aid in a famine. So providing that capacity to farmers is an increasing interest of the international organizations. In this case, they were given 4 options. They had the large and the medium-sized metal silos, a plastic silo and these were manufactured in Uganda. This is also manufactured in Uganda. And then there's a special kind of hermetically sealed bag that's made in the Philippines and then imported into the country. And World Food Program provided, through some grant funding, a subsidized products to the farmers in in Uganda. And we were able to go around and talk to some of the farmers who bought the products, and this is one of the women who was very proud to have one of the plastic silos in her household. It was a point of pride because she could then provide for her granddaughter more effectively and more safely. So, and these products are incredibly important to the people who were able to purchase them in Uganda. And so behind the ability to provide this is, right now these prices are a little high, so we have to still work on improving that supply chain, not of food commodities to meet people's needs, but of actually technologies that enable the local community to meet their own needs. So we're working on trying to lower the cost for these products to make sure they don't have to be subsidized in the future. They can be manufactured locally and made available to farmers who see value in them. So I've given a few examples of what I'm doing overseas in terms of supply chains to meet needs. I want to bring it a little closer to home and touch on one third point. In Monson, Massachusetts, in 2011, there was a tornado that came through, and it damaged one of the major churches in town and several homes. Soon after that, the church became a focal point for providing for needs of the people in the community. They set up in the basement basically a mini grocery store to provide goods for people because the grocery store wasn't stocked. And an MIT student and her sister actually helped coordinate some of the bringing in of these supplies because they saw the need to try to coordinate this. They started creating some information technology to do this, right? Initially, this was done through Facebook. So you would post your needs here, this is what we need, and then somebody would reply. You can do replies and say, I'll provide this. And so Facebook was the mechanism for this, right? And by the way, using kind of social media or other avenues is not unique to this particular situation. During the Sandy response, the Occupy Wall Street group became Occupy Sandy, and they appropriated the wedding registry for Amazon and started putting, instead of a wedding, they were planning a response for people in New York, and they were having things like Ziploc bags, and so they put a registry up, and people could buy them, and then, by the way, the supply chain for Amazon delivers it. So it was a very creative way to set up mobilize a supply chain quickly using online capabilities. But those two sisters in Monson started a company that then has continued to provide a mechanism for local communities to run their own operations. So one of the big things, and it's called recovers.org, and so this is an example of Staten Island during the Sandy response. They set up their own site, and on the site there, I don't know if you can read it or not, it says, I have a need, I want to give, I want to volunteer. Very simple, but it's a way of connecting people who want to provide support. And they did a tracking, they said that 70% of the offers of people's time and of goods come within the first 6 days. So if a community cannot mobilize that quickly, they're going to miss the opportunity. And this technology enables them to do that through donated items, but as importantly, through skilled labor. People who donate, who say, I can provide time, not only in the first few days, but on an ongoing basis. I will sign up to provide support to this community. They've now rolled this out to 117, as of last night, 117 different communities. It's a technology platform to enable the local community to provide for their own needs and mobilize resources locally. Because as much as I try to think I'm making an impact with improving supply chains for organizations like UNICEF, most of the response to a disaster and most of the response to needs comes locally through communities. And so I think that's the direction we're going in trying to help facilitate faith-based organizations, private sector organizations, and community organizations to tap into resources where appropriate, such as when the UN does bring in vehicles and transportation, but how to enable them with technology and with management techniques to be able to mobilize and respond directly, because they're more effective and they're more appropriate. So here's a closing slide of some of the things we're doing in our lab, and this is the mission that I've articulated for what we're trying to do, is meeting human needs broadly by improving the systems, the supply chain systems specifically, for both public services and also for private markets and for communities. This is in crisis response, but also this ongoing development of capabilities for food security and for global health that will not only provide ongoing services for people in need and for the poor, but in a crisis can be scaled up to meet peak demands and to fill gaps. We've been involved in Haiti response. I've had a student involved in distribution of food in Kenya. We're doing a study this year, actually looking, if you look at these bags here, these are bags of food. There's a U.S. flag on there. You can't see it, but there's a U.S. flag on there. So the U.S. provides a lot of food overseas, food aid. We're looking this year at a project to see how we can package that food so that we don't have to fumigate it, and we can save the cost, but also improve the quality of the goods by using different technology. We've responded close to home in New York City during Sandy. We deployed with the New York City Office of Emergency Management. And we also are involved in education. There's a strong community of humanitarian studies in the Boston area. Harvard has a strength in health. Tufts has a strength in food in terms of disasters. So there's a broad community. If you have interest in this, Boston is a very good place to study these kinds of situations further. And I've enjoyed being able to connect with some of the Gordon students directly on some projects. As we mentioned, Austin Drucker worked on the food vouchers in Sudan. Anna Junker worked on a project with UNICEF on a specialized nutritional product. And a couple students worked with us on the Haiti airport analysis. So we've had a few examples over time of that, and I would be welcome to further engagement like that. But I started with my own personal journey. I've now ended up at a point where I'm able to, through my professional choices, which were not obvious when I was an undergraduate student at Tabor College in Kansas, but through a series of choices and doors that were made available to me, I was able to enter. I have slowly, because of my convictions, been able to find a place where I can help meet people's needs, which is very important to my heart, but do it in a way that I'm contributing value directly, and I can raise my own funding from organizations to do that. It wasn't a linear path, it was not clear, but and you may not have an idea of where you might be able to do this, but if you have conviction and if you have some ideas of what might be possible and be open to the opportunities, there are a lot of interesting paths to help people around the world meet their own needs. I hope to pay it forward, all the opportunities I've been given, and I am blessed because I have been given many opportunities. I've had a lot of doors to be able to enter. But I hope to pay it forward by providing some further doors for people like you, for students like you, to enter going forward. So thank you for the time this morning to share what I'm doing. I am glad to stay around longer and answer any questions you have and any interest you have.